I'd like to introduce Katie Finley. Katie is a nurse practitioner in the medical ICU at Mayo Clinic, Rochester. You will appreciate her because she's got a very funny sense of humor. She's one of our most requested preceptors for APP students within our institution. So welcome, Katie.
Perfect. We're going to totally change gears and we're going to talk about common digestive disorders that you'll see in hospitalized patients. The title is actually a lie. It doesn't cover any of the GI disorders from the mouth to about a little after the stomach. So a little misconception there. We're going to review a couple different GI issues that you'll see in hospitalized patients. We're going to discuss diagnosis and management, and we're also going to talk just very briefly about patterns of abnormal liver chemistries. I know that's a big topic. And then we're going to briefly review acute hepatic failure. We're going to jump right in and start with a case study. So this is an actual patient, 41-year-old male, came from an outside medical facility with right upper quadrant pain, nausea, vomiting. He has a history of alcohol abuse, high blood pressure, depression with anxiety, and he's been hospitalized for 6 days at an outside hospital. Prior to that, about 3 weeks prior, he'd been hospitalized with acute pancreatitis, and he left AMA after 3 days. He had to get back to work. So you can see his labs there. His white count's obviously high. Creatinine, depending on what his baseline was, could be high, could be normal. Hyponatremic, his glucose is a little elevated. His ALK phos is mildly elevated. Lipase is 295. T-Billy is 3. ALT, AST are fairly normalish, a little elevated. These are his vitals. I just took a screenshot because it's easier to do than typing into a chart. So you can see he's tachycardic. A little bit on the lower oxygen saturation side for a 40-ish-year-old male. Blood pressure is normal. That is not on vasopressors. Respiratory rate's a bit high at 35. He's afebrile. And this is the CT that came with him from the outside hospital. So I'll give you a second to look at that and try and find any abnormalities before I circle them with my red circle. Probably won't take you too long. So what's your most likely diagnosis if you had a guess right now? Yep, so pancreatitis is your most likely diagnosis. And I'll go back to the image, and the thing circled is the pancreas, and then right next to it is a large pseudocyst. And a pseudocyst is something that you'll see in cases like these. They typically take 4 weeks or longer to develop, and they don't have an epithelial wall